And now, Dental Bites, with the dental hygienists of Dental Post.
And welcome to Dental Bites, where you have some cool dental professionals getting together, a bunch of hygienists, and we're going to talk about trending things in dentistry. So I am Amanda Hill, and I am a speaker and a writer and a dental hygienist, and I'm excited to be here today. How about you, Allie?
Hey guys, my name's Allie. I have been a full-time clinical working hygienist for the last 10 years, currently in Cleveland, Ohio. And I have been with Dental Post. I'm a key opinion leader for Dental Post for the last 4 years, where I write articles, I go into schools and talk to almost new graduates about what to expect once they hit the dental field.
Awesome, Allie.
Yes, I'm Kim. I have been a hygienist for almost 15 years. I work full-time in dental hygiene education. And then I also am really passionate about helping new grads, mentor them as they enter into the workforce. And then I also help out Dental Post with some writing and speaking as well.
Thanks, Kim. Hey, everyone. I'm Tina. I've been a hygienist for 25-ish plus years. Practice clinically occasionally. I am an educator, speaker, author, and a favorite of mine is being a syringe slinger. I love my anesthesia. That's my thing. And I've been working with Dental Post for a couple of years, doing kind of the same things as everyone else. So happy to be here.
Well, guys, I'm super excited to launch this series where we just talk about new trends in dentistry and kind of what's happening and what's on our mind. So everyone stay tuned and follow us to learn about what is happening in dentistry. And if you have a topic that you want us to talk about, go ahead and send an email to Dental Post and we'll find out about it. Hey everyone, welcome to Dental Bites. Hey Allie, do you have anything going on in your op lately?
Well, actually, yesterday I had a 29-year-old who it's been about 10 years since he had a cleaning. Blamed being in college, grad school, whatever the excuse. And he had very tenacious tartar pretty much on every single tooth. And yeah, I was sweating thinking about doing my scaling on him. But luckily, I just found this, I guess not a new product, but it's new to my office, called Hibenex. It's a desiccant.
Oh yeah, those are desiccants, right, Allie?
They are. Who here has ever used one or heard of a desiccant?
So I've never used one, but I've been at CE courses and I've seen them at like the exhibit halls and talked with them, and I've heard really cool things about it. What did you like about it?
Well, my favorite part is that it makes that tenacious tartar a lot softer and easier to remove. So for example, for my patient, I placed, it's almost like a blue gel. There's a liquid or a gel you can choose. I prefer the gel because when I place it around the gum line and around the tartar on the teeth, it sticks to that area. And you have to let it stick for about 30 seconds. You rinse it off, and then you get to scale. And the way the tartar just almost like melts off, it's like a clay white goo that comes off the teeth rather than, taking time going over and over again. So it really just helps the ease of scaling.
So tell me, Allie, did you liked it? So do you use it often? Do you use it with a lot of your scaling and root planing patients? Was this a one-time thing?
So now I absolutely use it for every single scaling patient. Any deep scale I do, I'm going to use it. But I also use it for your average prophy with supra tartar but healthy gum tissue. I still will put it around the gum line, let it sit for that 30 seconds, and it makes the tartar and the plaque and even some stain just come off a lot easier. So I use it often.
What is your patient feedback? Taste or feeling, anything from the patient?
No one so far has complained at all. I know the taste isn't amazing. It's not bubblegum, tutti frutti, minty fresh.
I had a patient tell me that it tasted like swamp.
Oh, okay. So maybe my patients are lying to me. Maybe they don't want to hurt my feelings.
I know. But maybe you're really good at getting it off. What I found was a really good trick for me when I was applying it was first dry the teeth and do it quadrant by quadrant. I wasn't doing it whole mouth at the time. So dry the teeth and then place it. And then I wiped it off with a 2x2 and then rinsed.
Okay.
And that way there wasn't as much like floating around in the mouth. But the cool thing was, and Allie, I bet you experience this too. When you rinse, you actually see chunks of calculus just float away. Like, because it's hydroscopic, right? I think that's the right word, meaning it sucks the water out of the deposit and it kind of takes away that barrier. It's sort of like, do you ever take an ultrasonic tip and like, not that you're supposed to do this, but maybe you do it. And you take the tip up, you take the tip that we're not supposed to use, right? And you put it into the deposit just to kind of fracture the deposit.
Yeah. Mm-hmm.
It almost acts like that, where then it kind of releases. So yeah.
So since it pulls the water out when you rinse, wouldn't that just rehydrate it though?
No, because it releases the hold and then it goes.
Gotcha.
Yeah, it's not like it doesn't like add to the glue or anything.
Cool. So it sounds like the pros are definitely on the clinician side, like reducing hand fatigue and all those kinds of things. And the con would be like patient taste.
But again, it's 20 seconds. So I think if you clean it off fast, but clearly Allie's a master.
Maybe
you're gonna have to give us a class on how to properly rinse.
Yeah.
I'm going to try that 2x4 trick though.
Yeah. Just kind of wipe it. Yeah. Cause then that's a little bit left, but seriously, only leave it on for like 20 to 30 seconds. It's not long. It's not even like they're like, and put it on for 5 minutes and keep the patient dry. Like,
no, it's quick. It's a very quick. And it also interferes, it disturbs the bacteria in the gum tissue. So it helps the healing process. They heal from the gum disease a lot quicker than not using it. So
and you know what else it does?
benefit.
It also, Allie, I bet you found this. It's hemostatic, meaning like you don't have as much bleeding.
Stops the bleeding.
And you can actually like see in the pocket. It's almost, you know what I'm talking about? Like when you blow the air and you can kind of see down, but then the blood's not in the way. So the one thing it can, like if you put way too much on or whatever, it can blanch the tissues, but that will come back. And then the only contraindication is if you have a sulfa allergy. Sulfa allergy. Anyway, you don't want to use a patient with an allergy to.
Well, it is important to know if it's sulfur or sulfa because those are two very separate things.
Double check that. Double check that. Anyway, double check that.
I want to say it's sulfa, but
thank you, Allie.
Yeah.
Which would make sense if it's bacteriostatic.
Yeah.
Right. It would make sense for sulfa since sulfa works on bacteria. So, Kim, probably one of the reasons why we don't get to play with it is since we're in the school setting on a regular basis. So like, we don't want to give students that opportunity, right?
Yeah, we used it in school.
You did? Okay. Well, then our schools better get with it.
Yeah.
You can't use it on boards.
No.
Oh, that would be amazing if you could.
Right?
I'd be very jealous, actually. Hold on. No, if I couldn't have used it, no one can.
And I'd love to hear feedback from anyone listening too, to let us know if you use it in your operatory, what you have found as your pros and cons. Reach out to us and let us know.
Yeah. So check out these chemical desiccants that are on the market. They're pretty cool.
I loved this bite of dentistry. Thanks, guys.